Here we go. So good morning, everyone. Thank you for joining us this morning. Today, we're going to be discussing the introduction to career planning policy presented by Laura Dom. A couple of housekeeping things before we get started this morning. My name is Kirsten Bayer with the Illinois Center for Specialized Professional Support at Illinois State University, and I will be your moderator and technical support for this session. So if you have any technical difficulties or need any follow-up materials or anything during the session, don't hesitate to reach out to me via the chat, and I'll put my email in the chat momentarily as well. For questions today, Laura has a lot of content to get through, so we're going to ask that all questions be put in the chat, and for you to refrain from unmuting yourselves. I've actually disabled that ability. So if you could put all questions in the chat, and then we can save those, and if we don't have time to get to them, we can put out a Q&A or an FAQ if possible. And also this session is recorded, and that will be sent out following the meeting for anyone who wasn't able to join. So if you have any coworkers or colleagues that need this information as well, we'll get that out. And I think that's all I have for housekeeping items. I do have the live closed captioning on as well, if you'd like to turn that on for note-taking abilities or accessibility reasons. And I'm going to hand it off to Laura to start her presentation.
Thanks, Kirsten. Good morning, everyone. Today we are going to cover the career planning policy as promised in our last all-staff meeting, just so that you can get an overview of the policy and that you will learn about the next steps that we plan on doing. So this technical assistance will cover the following objectives. We're going to talk about providing leadership vision for the policy, an understanding of the policy, to learn about the implementation, learn how the policy should be applied, and provide opportunity for feedback for OET staff. The OET has typically lacked some written guidance for the field on its vision of proper career planning, and so this policy was created to set that expectation of service delivery in the local areas. For service delivery, assessments, developing the IEP, the individual employment plan, and the individual service strategy, for documentation and case notes to create some consistency across the state. Career planning is based on the needs of the individual, and that ensures their success as they go through our program. Local area staff, along with the appropriate organizations that provide relevant workforce development and supportive services, provide these services for the local or for the participants. And this begins by looking at the delivery of services through a service integration on human-centered design lens. And this will become integral as the other workforce partner programs are beginning to be evaluated on performance outcomes. The implementation of the career planning policy will be supported through a human-centered design approach. And the graphic on this slide shows exactly what that entails. A human-centered design, or HCD is what you may hear it referred to, as a way of thinking that places the people you're trying to serve and other important stakeholders at the center of the design and implementation process. It is a collaborative, discovery-based process involving research, identifying patterns and surprising insights, brainstorming, new ways to serve those customers, and testing that out. In workforce development, it means shifting the mindsets and skill sets of career planners and workforce development staff to focus on improving the customer experience and outcomes for unemployed and underemployed people across the state. The policy outlines how the components listed on this slide are key to effective career planning. And the policy also reiterates that keeping accurate, timely, and descriptive records of career planning efforts through appropriate case management is essential. The career planner must be able to convey what is happening with the customers so that anyone, especially other career planners, should they take over for them, or our monitoring staff or federal monitoring staff, can get a full picture of the plan. As we always say, if it isn't documented, it didn't happen. The policy covers the following topics. Oh wait, customer engagement, application and eligibility determination, the basic skill screening tool, components of effective assessments, the development of the IEPs and ISS, proper service documentation, and case notes and file management. Customer engagement happens through either program staff physically present at the center or direct linkage via technology as defined in the governor's guidelines. Identifying information from customers must be requested to assist in tracking of self-service or informational activities. Individuals who access self-service or informational services either in the resource room, virtually, or through partner referral are noted as reportable individuals. A best practice is when a one-stop operator ensures coordination of services by creating an operation manual that outlines career planning best practices. Tracking of Title I-B self-service or informational service activities for reportable individuals are reported to the Department of Labor. However, those individuals do not count in our performance measures. When services require significant staff assistance, the individual is required to be registered as a WIOA participant. The individual must apply for services and be determined eligible. Adults and dislocated worker reportable individuals who are determined eligible and receive staff-assisted career services would be considered participants and included in performance calculations. Youth reportable individuals who are determined eligible receive an assessment and receive a program element. A staff-assisted individualized career service would be considered participants and be included in performance calculations. To document the application eligibility determination, career planners must enter the application into the appropriate case management system, determine eligibility using the edits in the system, securely collect the required documentation, and document information, determine priority of service. When entering the information into the system, career planners must ensure they are recording all barriers for youth. The eligibility date must be within 30 calendar days of the application date. If the eligibility is not determined within 30 days, career planners must ensure nothing has changed on the original application and have the customer re-sign the application prior to determine eligibility. The list of documentation to support eligibility is included as an attachment to the appropriate eligibility policies, and those can be found on the e-policy portal. The basic skills screening tool assists in identifying basic skills deficiency. It was developed to identify if an individual is basic skills deficient by determining if an adult or youth is unable to compute or solve problems or read, write, or speak English at a level necessary to function on the job, which is the second part of the WIOA definition of basic skills deficient. This enables the determination of basic skills deficient for purposes of referrals or meeting priority of service prior to giving an assessment. Note the basic skills screening tool is not an assessment, just a tool to determine priority of service or referrals. If the tool identifies an individual as basic skills deficient, then career planners are to do one or more of the following things as appropriate. Either provide the adults with priority of service, document this is a basic skills deficiency for the purpose of eligibility for youth, refer adults and dislocated workers to adult basic education services through Title II, or facilitate referrals to other partner programs within the community for service. And there's a fact sheet that was created for basic skills deficient, or the basic skills screening tool. It is located in the resources tab of the career planning policy and e-policy. So I know that sometimes there's quite a bit of questions surrounding this. So please review and disseminate the sheet to the field as you see appropriate. Under WIOA, an effective assessment is the foundation for understanding the participant's employment goals, existing skills, career readiness, and determining all appropriate barriers to education or employment that may exist. This is an ongoing process and guides the development and modification of the IEP's ISSs. Assessments are more than the required basic skills deficiency assessment. The skill level tests are assessments that we give, which are the TABE and the CASAS goals, which we will discuss later in this presentation. But there are other types of assessments, including considering the abilities, aptitudes, interests, and occupational employability of the participant. An assessment for abilities, interests, employability, etc., may be a formal computerized assessment or informal, such as communications between the career planner and the participant, including observations made during those interactions. Since a person's situation may change, barriers to employment and training are to be assessed on a continual basis. Supportive services and/or referrals to other community resources may be provided as needed. And you want to make sure that they're looking at suitability. Career planners must ensure that the individual has the skills necessary for the person to gain and retain employment or successfully participate in training. Career planners must ensure they are providing the appropriate assessment tools for the participant. For example, one assessment to determine digital literacy may be right for one participant and not right for another. Additionally, participants with disabilities also may need information on support such as assistive technology or other accommodations, and may benefit from less formalized career-related assessments. These assessments may be provided directly through WIOA program staff and/or through referrals to national and community-based partners and resources. All discussions with participants should include informed customer choice. These discussions must be based on accurate information to ensure the participant is making the right decisions for themselves regarding career opportunities based on labor market information that provides a living wage, including information about education, entry requirements, and income potential. If a formal assessment has been completed by a partner agency within the last 6 months, then it may be used only if it addresses a review of basic skills, occupational skills, prior work experience, employability, interests, aptitudes, supportive service needs, and developmental needs. Again, we created a fact sheet for assessments, including basic skills assessments, and that is in the resource tab of the career planning policy and e-policy. And again, please review that and distribute as you see necessary. An initial assessment is done during intake as a basic career service for adults and dislocated workers. The initial assessment may assist the career planner to determine the more in-depth assessments that need to occur as an individualized career service. Assessment results, not just the actual scores, but what the assessment results mean, are to be recorded in the appropriate case management system. And that information should be used to develop the IEP and any subsequent modifications that are necessary. For the youth program, including youth with disabilities, those may be limited to assessments on prior work experience, employability, interests, and aptitudes, but there's multiple assessment tools that may be necessary since no standard approach will work for youth. Career assessments will help youth understand how a variety of their personal attributes, their interests, their values, their preferences, their motivations, their skills affect their potential success and satisfaction with different career options and work environments. And just as with adults and dislocated workers, youth also need access to reliable information about career opportunities that provide a living wage. And participants with disabilities may also need additional supports. Note these type of assessments are available for selection in the case management system. The different ones are interests, aptitudes, skills, barriers, and others that are listed in the policy. Again, some may be formal and some may be informal. And those test results must be recorded in the system. There are several allowable assessments. The allowable basic skills assessments is the term that we use to refer to those assessments that look at reading, math, or language levels, and they need to be necessary for, those levels need to be necessary for enrollment into a training program. These assessments are covered in Chapter 5.9, Basic Skills Deficiency Assessment Requirements. For English-speaking individuals, right now, that is the Table 1112 or CASAS goals. And for English language learners, there are 3 options: the Best Literacy, the Best Plus 2.0, or the CASAS Life and Work Reading. Local staff must be trained on how to provide these assessments, and the Illinois Community College Board's Professional Development Network provides training not only for adult education provider staff, but for WIOA staff as well. And they also provide, as a result of the COVID-19 pandemic, the ability to remote test. So not only must staff be trained in how to provide assessments in person, but they also must be trained to provide assessments remotely. And given that the local career planners have the ability to remotely test now, if they've attended this training, or that the local area can partner with their adult education program to do this testing, there should not be an instance where a participant cannot be assessed on their basic skills. There are exceptions to individuals that are required to have their basic skills assessed, and that is covered in Policy Chapter 5.9. Now we're moving on to the individual employment plan, or the individual service strategy section of the policy. An IEP ISS template is in the process of being created. We will use the TAA version, as well as a fantastic sample that was provided to us by Robin Krallman. And so we're working on that to get that to the field. The field has very much asked for that in the past, and so we intend to assist with that. The IEP ISS is a plan in progress, and it should be updated to reflect the actual combination of services needed to meet the employment and training needs of the participant. Career planners must use the results of the initial assessment of skill levels and supportive service needs, and the comprehensive and specialized assessments to devise a plan of the combination of services identified on the WIOA service matrix that will allow the participant to meet their agreed upon employment and training goals. And we'll talk about the service matrix a little bit more here in a second. All participants must have an IEP or ISS with at least one open goal and one open objective. And we have taken the smarter approach on writing those goals. We're goal setting the smarter way. This is a mnemonic acronym that can be applied to goals in a way that makes them easier to tackle. And the definition of these, as they're related to career planning and workforce, are included in the policy. There's a chart that includes that information. And note that this was taken from the Cook County Workforce Partnership. And so it was something that worked well there, and we wanted to ensure that it was duplicated across the state. Developing and then modifying the IEP as necessary is a vital service for adults and dislocated workers that must be done in order to guide the participant through the services that will help them achieve their goals. The IEP must identify those goals and objectives and the justification for why those goals are appropriate for the participant, given the information learned from the interviews and assessments, as well as their previous employment and their skill gaps. The IEP must also identify the appropriate services needed for the participant to reach their goal. It must address their strengths, their challenges, their needs, and the participant will be getting training services. The IEP and case notes must document the conversations regarding informed customer choice on the training program. local labor market conditions, local employer skill demands, hiring prerequisites, in-demand occupations in the area must be part of those discussions. Furthermore, if training is an option for the participant, the career planner and the participant must review the demand occupation training list together, ensuring that it is understood that since this is a statewide list, it may not be reflective of the demand in the local area or where a participant would be willing to commute or relocate for work. And as always, the suitability of the training must be taken into consideration. The IEP must also identify the barriers and needs of the participant. This will assist the career planner to determine the appropriate mix of services and referrals to partner programs. Identification of and addressing all the barriers may assist in performance outcomes for the local area and state when we begin to utilize the statistical adjustment model. Each goal for the participant must be linked to at least one performance outcome. And the IEP must identify the next steps for the participant to reach their employment or training goals. Like the IEP, developing and then modifying the ISS is necessary is vital for youth and must be done in order to guide the participant through the services and must be the first service recorded in the case management system. The ISS must address a summary of the goals and objectives, focusing on the activities and tools needed for achievement along a specified career pathway. Services for youth are included in the WIOA service matrix and are listed under the appropriate youth element. So when you see the WIOA service matrix, when it is issued, and we are working on finalizing that matrix now, it will be, each service will be listed underneath each of the 14 service elements. So it will be an easy way for career planners and others to determine exactly what needs to be provided and which element it falls under. Additionally, the ISS should address a list of action steps to eliminate or minimize the barriers that have been identified, including referrals to partner agencies, and a link to one or more of those performance measures and a method for tracking progress for identifying the next steps. The IEP ISS is a living document and will more than likely change. If additional barriers are identified or resolved that alter the established steps for meeting the participant's goals, then the IEP ISS must be modified. To assist in identifying issues or potential issues that would affect the IEP ISS, career planners must review the document on a regular basis, at least once every 90 days. However, it could be done sooner if something comes up during the regular, meaningful two-way communication, which must occur every 30 days. And note that these timeframes mirror the trade program requirement. Changes to the IEP ISS must be done in collaboration with our participants' consent, as reflected by a signature on the updated modification of the IEP ISS, and a copy must be provided to the participant. These changes must be reflected in the IEP ISS service and the appropriate case management system using the same-day service additional episode rules that will be discussed in the next section. Service documentation. The WIOA Title I-B service matrix is very close to being finalized. We are working on this as we speak. Once this work has been done, it will be added as an attachment to the career planning policy. Services must be documented in the case management system of record within 10 days of the service, and all services must be documented. Again, if it isn't in the system, if it isn't documented, it didn't happen. Career planners must maintain regular contact with the participant. The definition of regular contact is two-way communication that occurs every 30 days, which mirrors the trade program requirements. They must also use the WIOA service matrix to not only develop the IEP, but to ensure that all services are being accurately recorded. Career planners, as well as OET staff, must understand how to use the same-day services and recording additional service episodes for those same-day services. And Training for those same-day services and adding additional episodes has been developed by Jim Potts, and he has been including that in his training that he is currently conducting. All services must be entered into the appropriate case management system within 10 calendar days of the service. Case notes must also be entered and describe the service and any other notable information. Case notes will be discussed in the next section. Services can only be recorded in the appropriate case management system on or after the date the participant is certified as being eligible for WIOA services. All services provided must be recorded in the appropriate case management system. All service records must be closed or ended with either a successful or unsuccessful status within 10 calendar days of learning of the completion of the service. Any outcome of education or training services, such as credentials earned or MSGs, must also be entered within 10 calendar days of learning of attainment. This is critical for performance reporting. Guidance on data entry for Career Connect is provided as a link in the resources tab of the policy and the e-policy system. And we are in the process of developing some guidance in addition to Jim Potts' training that he does to assist with documentation in the system. Case notes and file maintenance are vital and are heavily reviewed by OAT staff and especially the Department of Labor staff during monitoring. Case notes must be written in such detail to tell the story of the participant and their services and document the ongoing two-way communication. They also must be entered within 10 calendar days of the service delivery and regular contact. Note, everything is 10 calendar days. Robin Krallman has developed a presentation on effective case noting that will be highlighted in an upcoming Wednesday webinar to support the implementation of the career planning policy. And the training will cover the purpose and importance of case notes, characteristics of a well-defined case note, important rules for writing case notes, the privacy and confidentiality of a case note, the top 3 case note issues that are found by staff, and sample case notes. Case notes must also indicate cross-program coordination. The concurrent program screen in IWDS is to be used to indicate which partner programs the customers are also enrolled. Their participant case note history must reflect the following information under the appropriate service: an introduction, a determination of training need, including suitability if that's applicable, and the training begin date if it's applicable. Let's see. Sorry, I got lost for a second. The case notes must also include the training end date, if applicable, the service closure, exit, and the description of follow-up services. In addition to the list of items to be recorded for training end date, it may be helpful to tell a story to identify the reason for any unsuccessful completion. Beginning with the career planning policy, OET provided responses to questions posed by IWP after their review of the draft policy, included those as part of the resources attached to the policy. There is a webinar scheduled for tomorrow on introduction coaching model of the career planning policy. And there was a workforce professional development email that went out on Monday morning from the ICSPS that provides a link for registration. This webinar will introduce a coaching cohort model that has been designed specifically to support the rollout of this policy and help the system move towards a more human-centered design approach to their work. The cohort training will be a 7-week local team-based module supporting the implementation of the career planning policy through a human-centered design approach. And those local teams will need to apply to be a part of the cohort. In addition to that training, we are also looking at providing topics using setting the smarter objectives and goals, the use of iPads in career planning, the Title 1B services matrix when it's finalized, the IEP ISS template when it's finalized, the career or the case noting that will be done by Robin Krallman as well. The implementation steps for the policy, the application is that monitoring staff must understand the policy and the leadership vision in order to ensure that it's being properly implemented during monitoring efforts. And anyone conducting technical assistance or training must be mindful to reference and incorporate this policy into their training. Now we have time for questions. I tried to run through it pretty quickly, so I'm sure there's probably several questions. Let's see if I can pull up the chat. All right. Will a copy of this PowerPoint be provided to participants? Absolutely, Carmela, it definitely will be. And I see Kirsten went ahead and sent that. Kirsten went ahead and sent that out. John Barr noted that the appropriate case management system means IWDS for participants served under WIOA formula funds, Illinois WorkNet for participants served under some of our non-formula grants, and Illinois WorkNet for some of our other grants. When will the invites be notified to the cohorts? Cohorts, first of all, to explain a little bit more on that upcoming webinar tomorrow, it is just an introduction to what human-centered design is all about. It is to get buy-in from the local areas to create teams that will come together. It will be teams made up of different partner programs across the local area or the region. Those teams have to apply to be part of the cohorts. We probably will not be part of those cohorts, although we can ensure that we know what's being taught, but we will not be part of the local teams. So I just wanted to let you know that. Yes, and Mark also added for those in the Chicago area, the system of record is Career Connect. So, any other questions? Well, I went through it kind of quickly. Make sure that you take the time once this presentation is sent out is to make sure that you look through it again in more detail. It's pretty self-explanatory. It's something that we've known all along that this is how it should work. But now we've actually got it in writing for the field to follow. And this policy, John, this policy went into effect, I believe it was in December. I'd have to go back and look. Been working on too many different policies. Carmela asked about Robin's presentation. That will be done through a Wednesday webinar, and therefore if you look at your emails that you get typically on Monday mornings from the Workforce Professional Development Group from ICSPS, then there will be a link to register for that training. Mondays and Wednesdays. Thanks, Kirsten. Well, if we don't have any other questions or if no one else wants to add anything, I will be happy to give you some time back to your morning. And I hope you all have a good day. Thank you.